Nowadays, even small kids are suffering from asthma. So, what according to you is the most probable reason for this?
We have very high cases rate of the asthma nowadays, and that's because of the pollution. And most of the time, there's construction going on around the child's house. So you have to protect these children because the construction material has chemicals nowadays, not a simple dust. So you have to protect your child from the dust, this type of materials, pollutants. So they are, and it is genetic also. If you have anybody in family, then child may have, and then you have to take care of the allergy at early stage. If you take care of your nasal allergy and throat infection at early stage, so you will prevent asthma to occur.
Okay. A small baby rarely responds to noise. So, how can a parent identify that he is suffering from some disease or some hearing loss?
You mean
Hearing
child
loss,
hearing loss in very small children? See, the dictum is that if the mother says the child is not eating, usually we don't pay much attention because every mother feels so.
Yeah.
But if mother comes to us and saying that she feels the child is not able to hear, most of the time mother is right, because you can drop a smooth spoon behind the child's head and she should turn. Even the smallest child will turn the head, or at least give some reaction. If that is not happening, you should suspect. And now it is very, very important that this should be detected earlier. Earlier we used to get children which are already crossed that stage where we can help them. They may be at the age of 4 or 5 or so on, when the linguistic or the speech has already has had to be developed and couldn't develop, and it's very difficult to develop speech then. So they have to be caught earlier, before 1 year, before 2 years, at least before 2 years. So it is important. At home also we can do this with simple methods to check.
And what are the causes for such kind of deformity?
Usually in a very small child, the hearing loss is congenital. If too much of hearing loss is congenital by birth, but there are sometimes trivial things like wax. In very small children, meconium is there. A child is suffering from cold, can have fluid inside the eardrum, and which can also cause hearing loss. So you should go for ENT checkup, let these things be ruled out, and then go for a examination, proper examination.
In our society, the children who are deaf and dumb are being treated as mentally challenged. So, what according to you is this a myth or a truth?
Totally a myth, and it should be broken as soon as possible, because deafness, there are certain syndromes where you can have all these things happening, but most of the children with deafness, and when they are deaf and not taken care in early period of life, they become dumb also. Dumb doesn't mean dumb by mind. Dumb means can't talk. So they are not mentally retarded at all. Sometimes they have more intellectual than routine children. Their concentration is much more than us.
Okay. And what is the difference between being deaf and being deaf and dumb?
See, if there's a deaf means you're not able to hear, but if I don't take care of this child in time and don't help him to talk or give some auditory stimulus, the child won't able to talk, because our total speech center depends upon what we hear. So there are children who were able to talk earlier, but then they lost the hearing, and they won't be dumb. They won't be dumb in the sense they will be able to talk. But if a child from beginning is not able to hear, if he's not heard anything, won't be able to speak, they become deaf and dumb.
As you can see, there is a change in weather. So, what precautions would you suggest to the parents that must be taken by each parent?
See, nowadays, most of the time, what I am seeing, it is our own atmosphere. That means our temperature which we keep in our rooms and temperature which we get outside. That is number one thing. We keep our temperature maybe in 18, 20, 21. Outside we are getting 30, 35. So there is sudden change of temperature. That should be avoided, especially small children. So you have to take care of your air conditioning at home. Then there is this season you have pollens around. So if you have a family history of allergy, or child had been having allergy, avoid taking them out in the early morning hours when the pollen strength is maximum, or opening a window in very early morning hours. Of course, pollution has to be taken care of. The child has not to be taken to the polluted places.
As you can see that even parents pour some oil drops into a baby's ears. So what according to you, is this safe to use oil drops into your baby's ears or not?
Good, you picked up this point. Because earlier oil drops, certain types of oil drops were being put because the things were not available. Now we have got pure ear drops which help the children for different diseases. Oil drops, if put inside and the child has a fungus or any other infection, it will get enhanced. So we don't recommend any type of oil drops in the ear at all.
What is your message to our parents?
There are few things because in my practice there are certain things which I have to tell, which I have mentioned earlier also. Do not fiddle with your child's ear. Sometimes the parent comes that he doesn't allow me to clean the ear. He is doing right. Don't try to clean the ear. If you see something, if it's by torch, ask your doctor, put some ear drops and take them to doctor, get it clean. Sometimes small amount of wax after putting drops, they come out of its own. So do not fiddle with it. As far as ears are concerned, if you feel that any child in your vicinity is not able to hear, you have smallest suspicion, do not delay. Take him to the doctor as soon as possible so that you can take. Even if it is negative, you have come to know that okay, now it is okay. But if it is positive, that means the child is not able to hear. That means we can catch them early and help them to come to the normal society. That is number. As far as nose is concerned, yes, they should not allow children to pick their noses, and food is very important. And one of them is silent killer. What we call silent killer is preservatives. When you ask give child because you succumb to their demand, and then they eat all sort of things which have lot of preservative, color. They damage their throat and nose, and they can be allergies because of the preservative. So you have to give them healthy, good food. Fourth thing is what most of the children get, they are not able to eat anything. As soon as child comes from the school, you give them drinks, cold drinks or something. The child appetite gets killed, and then they will not go for a healthy diet, and they will definitely later on will munch something like chips or something which is in form of snacks. So you as a parent have to be careful that the feeding time should be in a proper way. Don't take shortcuts for that.
Okay. Thank you so much, ma'am, for your
Welcome.
precious time, and we would like to thank you on behalf of Just Dakhila.
Thank you.